hustle when we grind to get to where we're at. Our purpose we will find, so we gotta stay on track. Wasn't easy for no one, life is tough, we understand. No, you're the chosen one, this is all part of the plan.
It's all part of the plan and it's game time. Regardless of the struggle, man, we still grind. Always motivated and hustle, so we all rise. Minority Report, future bright, so we all shine. Let's go.
All I ever wanted was my dream. It's like you want it ever what it seems. I want the life you better hustle, hustle hard. You tell me I can do it, I go hard. And they gon' know I did it from the start. You want it all, you gotta hustle, hustle, hustle.
This is
The Minority Report
Movement.
The views, thoughts, and opinions on this podcast are solely ours and do not reflect the institutions and organizations we are affiliated with. Episode 6, Minority Mental Health. Please enjoy.
Welcome to another episode of the Minority Report. We are four soon-to-be PAs with different backgrounds, attending different programs with different life experiences, bringing awareness to various issues that affect students on their journey to healthcare and medicine. I'm Carlos, and today I'm joined by Aaron, Sato, and Carl. Guys, today we'll be talking about minority mental health since July is the BB Minority Mental Health Month. To start us off, if you'd like, Aaron, just talking a little bit about your exposure to mental health in medicine.
Yeah, man. So one thing that's pretty big right off the bat, it's been in medicine in terms of like this patient population, this specific patient population, even well before I started PA school, well before I even, stepped into the medical field. But Cambodian Americans, they're actually, or Cambodians in general, they have the highest rate of psychological distress and trauma amongst the refugee population. So for those who don't know, between 1975 and 1979, the Khmer Rouge took over Cambodia, and it was essentially a genocide that wiped out 2 million Cambodians. People were forced into labor camps and forced into the countryside from the city. There's a lot of propaganda, a lot of brainwashing. The leaders at that time the communist leaders were telling the people like, hey, get out of the city. The US is about to bomb this country, so you guys all need to move to the countryside. And then, brainwash people and thinking like, you can't trust your own family, you can't trust X, Y, and Z. They raped and tortured women, they starved people, and again, 2 million people died. And so those who did survive, like my parents, like my, aunts and uncles and stuff like that, they went through these refugee camps and then, came to the US or France or other countries like that. But, there was a recent survey of survivors from the Khmer Rouge, and all the participants had been exposed to some type of trauma before they immigrated to their respective countries, and they all were refugees as well. And so the survey, out of like the 490 people that they surveyed, 483 of them experienced starvation, so 99% of them. 437% of people, so approximately 90% had a family member or friend who was murdered, and 338, approximately 70% of those people were exposed to some type of violence. And so, those are some typical events that, lead to PTSD. And pretty much, various studies have come out to show that, more than 60% of Cambodian refugees have experienced PTSD or PTSD symptoms. But the caveat is only a small percentage of Cambodians even know what PTSD is. And there's an even smaller percentage of those Cambodian PTSD patients who actually have those issues addressed. So, people might wonder like, why is that the case and stuff like that. But the thing is, there's that lack of intervention in the medical and Cambodian communities, because there's this stigma. There's this stigma of having a mental disorder or being crazy or, having any psychological symptoms and manifestations. Just because, during the Khmer Rouge regime, during the killing fields, people were supposed to be quiet. They weren't supposed to say anything, weren't supposed to trust nobody. They weren't supposed to show emotions, and pretty much bottled everything up. And like, I even saw it firsthand with like some of my family members when they came here. Like just kind of like the aggression that they had pent up, or a lot of the elders won't even talk about like the horrors that they went through, and stuff like that. And so it's because of that negative stigma and negative connotation to mental health, that Cambodians refuse to assimilate to the American lifestyle, to culture and the language and stuff. A lot of times it's like by the time they get here, they're already like in their 30s, 40s. And so like they think they're too old to learn a new language and new lifestyle and stuff like that. And the second generation, or like the people who were born in the refugee camps or like very young and went through the genocide, like they are still trying to bridge that gap and still try to address that taboo of like mental health and PTSD, and try to provide like a better response for their parents and their elders, and also try to help like my generation. So their generation is like generation 1.5, and ours is like generation 1. And so for us to try to understand the PTSD behind all those Cambodians, and try to fix it and try to get help for them, but at the same time it's hard. So this stat right here blew my mind, where they said 2/3 of Cambodian adult refugees suffer from PTSD. Over half of them, so the majority of them, have major clinical depression, versus in the US the general population has only about 3% of people suffering from PTSD, and only 7% having major depression. So there's just like that huge healthcare disparity, like what we talked about in the other episode. And at the same time, this mental health stigma, and this is just what I've witnessed again prior to PA school. And it's unfortunate, but it is what it is. So
I have a question for you, Aaron, because I know I've watched documentaries in the past about the Khmer Rouge, and correct me if I'm wrong, but a lot of the people that were executed were people of higher intelligence, like higher, I guess, education, doctors, lawyers, other politicians, people that were educated. And do you like, if a government comes out and says that these people are evil, and they start executing those people, do you think that impacts your parents and your grandparents' generation from wanting to seek out help from doctors who were labeled as evil and people that needed to be executed? It's like, do you think that plays a role in their kind of I guess inability to go seek care?
Yeah, I think it definitely does play a role into it, and you're spot on with the historical accuracy of it. They murdered anybody, even if you were wearing glasses. They thought you were educated, and so they murdered you. And the reason being was because they didn't want anybody to like revolt against their revolution. And so they pretty much took out anybody who was like in opposition, whoever was educated. And yes, doctors and professionals were taken out. And it even got to the point where some of those doctors and some of those teachers and even musicians like tried to lay low and carry off as like peasants and uneducated and farmers and stuff like that, so that they won't die, right? So they don't get killed. But so like that lack of a figure in the community where they can go to and reach out to, like a doctor or a healthcare provider, I think definitely plays a role into it. And the mentality was like, don't trust anybody, not even like your own family, not even your own parents. So why would any of these refugees trust a complete stranger? And, them coming here at the time, there wasn't a healthcare provider who spoke Khmer, who understood what traumas that they just went through, so like some of the healthcare providers who were here that were Americans, like they had no idea what the killing fields were like. They didn't have no idea what the labor camps were like. So how can they even, help some of these people, or how can these people even explain what experience they went through, So I think there's that huge disconnect as well.
Yeah, I think
Crazy. Yeah, I never even knew all that. And when you talk about PTSD, usually we just talk about like the military and stuff like that. But it's crazy, how many cultures, how many people are affected, right? So before I even talk about the military, I want to first acknowledge all of the victims of like domestic abuse and rape, and women that eventually develop PTSD as a result. But some of, I guess, instances that I might have experienced in my career, which some of it would definitely be military. I know a lot of soldiers who come out essentially, or whether it's after deployment or even after basic training, or AIT, which is essentially their individual specialty training. A lot of them come out and essentially don't understand how to operate in life again. When you go in the military, essentially the role of the service is essentially take that mindset that you had previously, in the civilian world, and kind of take that away in a sense, and kind of build you back up as a soldier, right? Almost kind of like as a robot. So essentially, you kind of be numb to a lot of things, right? Because you essentially going into certain situations where you don't necessarily have time to kind of react emotionally. Kind of have to essentially just react off the gut, or essentially just to essentially save your life. So there's a lot of people that come back and do not know how to process those emotions, right? Nor is there adequate help for people there, especially in the service. I mean, they're trying to do better, but I know the numbers are still really high as far as service members that are suffering with PTSD. And as you guys know, with how the VA has been acting, it's difficult for people to access care. Also, what people I don't think talk about as much, but is almost as prevalent, is PTSD in urban areas. There's a lot of people, like we see so many murders, and I remember in Philadelphia one year it was like 400 killings in a year. It was more killings than days of the year, essentially. So you have to think that that has some effect on people, right? I was about to go into a person's story today, seeing a trauma in the hospital in the ER, and knowing that effect that's going to have on everyone that was involved in that code today is essentially the same thing as people in the neighborhood, right? You see people getting shot left and right, or you might have got shot left. You might have got shot. It's going to have an effect, right? But people don't take that in consideration when they come and present with other symptoms, right? And then you brought up another point about stigmas, right? So in our community, people don't come in the facility and saying, "Oh, I'm depressed." Like it's kind of like a sign of weakness, and it's not, and it shouldn't be. But that's how I know some people look at it. So they may disguise it as something else. They may come in and say, like, I'm quote unquote sick of tired. I'm sick of tired of being tired. I hear that's a quote that's often used. Or they might just come in as fatigue, like literally, kind of like the definition, like somatization, right? Psychiatric illnesses essentially presenting, manifesting physically. So, we have to be able to understand that and meet these patients where they are, when they come into our offices, and have to take that time to dig a little deeper, or get these people extra resources, that they may not know how to find on their own. Right.
I think you guys have brought up a lot of good points. I think understanding the history, the culture of our patients is important to help us better identify basically at-risk patients, right? Because if you don't understand the generational trauma, the immigrant trauma, whatever patient presents, in front of you, if you don't have that culture of humility and understanding, then how can you really assess, a person being there just for a physical? And is it realistic for every provider to have like this holistic understanding? Perhaps not, but I think this highlights the importance of why it's vital to have, to diversify medicine. I think also just having a conversation as mental health and kind of separating that from just your physical health is also kind of telling of how we usually look at this like separate, but even though I think the World Health Organization has included mental well-being in the definition of health. It's something that we talk about separately, but in reality, it's all in one and the same, because you can have somatization where you are presenting with like fatigue or chest pain or racing heart, what have you. So I think if for the next point, if we just talk about the mental health as providers, as people in medicine, and through the lens of being minorities, do you guys feel that we are supported? Like, have you guys felt supported as students, or even as pre-PAs? What has been your experience with mental health?
I can go ahead and start. I would say, I think coming into the healthcare field or health professions program, there's this stigma, like what we were talking about, where we don't really talk about, stress and anxiety and the pressure of getting into a program, right? Because that's super stressful, and nobody really talks about like our mental well-being or mental health in that sense. And then also, when we're in school, and that's why, there was how many suicides for like medical students or like dental students and stuff like that. I saw that figure. But every time that happens, like it's eye-opening, but at the same time, I feel like not a lot is done still, right? And so our program, I feel like, we're super supported by the university, where they reach out to us every so often. They have counseling available, they have outside resources, and a lot of the times it's like it's out there. It's just a matter of people reaching out and actually utilizing that help. And people are afraid to use it for whatever reason, or they think like, I don't need to. And there's that idea that it was like, check on your strongest friends, right? A lot of times, most of them are the ones who are going through stuff and are a little more likely to kind of sweep it under the rug and check on everybody else to make sure they're good. But deep down, like they got their own battles, and it's unfortunate because it's like people are there to talk. Like, I feel like as healthcare providers, even as healthcare students, like we're not going to chastise each other and be like, oh, so-and-so is suffering from anxiety and depression. Haha, like nobody's going to do that. They're going to be like, hey, what do you need? Like, is there something that I can do to help you? I understand to a certain extent how you're feeling. All of us have this, and it's valid. Your thoughts and your feelings are valid, but how can we help? What can we do to make you feel better? So I think we need to utilize each other as resources as well.
Yeah, I think you brought up a really good point that there are resources out there for us. I think the difficult thing is acknowledging that you need help when so much of your culture is based off of mental health not even existing, right? Some people say it's a taboo subject, but it doesn't even hit the point of being a taboo subject because it flat out doesn't exist. Being like growing up and stuff like that, we've always been taught work hard, working hard is the road to success, right? There's no time to be depressed. There's no time to feel anxious. There's no time to do all this other stuff, and it kind of, growing up, I went through a lot of tough times, but at the end of the day, I always thought about, how much my parents sacrificed for me to be here. I never talked about it before, but my dad moved back to Japan when I was in middle school. So me, my sister, and my mom could stay here so we could go get an American education, so we could stay here for the rest of our lives and pursue whatever dream we wanted to pursue. And the sheer, that's probably one of the biggest sacrifices, just to leave your family behind so that they can have a better life, and that was kind of the mentality I always had, was no matter what I'm going through, I can't disrespect my dad, or I can't let my dad down, by wallowing in self-pity, or, that was kind of the mentality I had. Not that, being depressed or being anxious means you're wallowing in self-pity by any means, but, that's kind of how I saw it. And it was hard. It was difficult, and even these last year and a half or so, right before I started clinicals, I started having, palpitations. I was going through every night when I was trying to sleep, even during the day. It was just, I don't know. I'd feel like I was going to try driving him. Carlos, I was having dinner with you one time, you remember? And I was having palpitations, and, it was something I dealt with. And, it took me up until maybe a month ago when I finally realized that it was honestly this sheer amount of stress and anxiety that I was going through. And that's what was causing it, because, I started getting out, doing stuff that I love to do, and for the first time in a year, I've been able to go to sleep without having palpitations for a majority of the nights now, and that goes to show you that even when we work in healthcare, even when we're this educated, educated enough to know what the signs and symptoms are, or, what the risk factors are, we still manage to put things aside, right? And, I think in order to help others acknowledge, or understand the impact that mental health has, we must first look inside and look at ourselves and see if we are taking mental health as seriously as we need to. That's just my 2 cents on the issue.
Yeah, I think society plays a large role in how we look at mental health. We did an exercise in my program where we said, all right, we had a category of mental illness, another category of medical conditions. And we said, okay, the people with the mental illness, what are terms that are kind of associated with people with mental illness? Some of them came up as wacko, crazy, unstable, schizo, bipolar, right? And so, okay, medical conditions, what do you call them? Somebody with heart failure, what do you call them, right? Somebody with hypertension. So how come, we classify somebody with mental illness with these names versus somebody with a medical condition, right? So people with mental illness, we make it seem like they essentially are that disease, and not that they're maybe living with this condition. So first, having that mindset and getting out of that mindset, I feel like it's a step in the right direction, right? Other things that my program did to kind of bring mental awareness, we had like an orientation week, and we did mindfulness exercises, did some box breathing and things of that nature. These are things like I never, was exposed to before. And I was hesitant, to be honest. I'm like, that's not cool. Or, I just felt like that wasn't, maybe I didn't need that, right? And then the program started. I'm like, oh yeah, I need this. So I'm glad that, that resource was available, and they did tend to reach out like after certain exams that they know were really stressful. But we still had people that were clinically being diagnosed with depression. It can stress enough, how important mental health is, like taking care of yourself. Like you can't take care of no one else until you take care of yourself, right? And you have to be real with yourself. It doesn't make you weak, right? It makes you actually strong, understanding yourself and wanting to do something, right? And I understand that not everyone has that mental capacity, right? We still have a lot of, people that are being taken care of by other caregivers. We have to acknowledge them as well because they're put in unimaginable situations, right? A lot of selfless service.
We did a similar exercise to that one, Carl, and my program has also, I think, been very supportive as far as making sure that mental health or just behavioral wellness resources are available to us. I definitely want to thank Sato for kind of opening up about things that he went through, because I feel like as future healthcare providers, people that we have platforms, right? People are looking for us for guidance for our experiences, and I think we may be doing a disservice by not opening up about the struggles that we do face on the mental health side. So I can also relate in the sense that there's a long history of anxiety in my family. So anxiety is something that I've been learning to manage, and I thought at first just with weightlifting, just being out with my friends, that was a form of therapy. But in reality, once you add PA school and new stresses in life, I think I realized that that wasn't enough. So I think there's value in opening up about the mental health challenges we face, especially because I feel like as people of or that belong to minority communities, I think we encounter discrimination and challenges at greater frequencies than our non-minorities counterparts. And so, I mean, in this case, I am a Latino male, so there is some privilege to just being a male in this country. But think about the groups occupying multiple disadvantaged social categories, race, ethnicity, gender, religion, socioeconomic status, and how much more vulnerable, each community is as you start to compound, different kinds of minority factors. Some statistics that really stood out to me is that it's similar to what Cooper was saying in our last on one of our last episodes about how heterosexual suicide rate is 2.3%, but if you look at bisexual communities, 7.4%, transgender 30.8%. And if you just want to talk about also with more just racial disparities, 13.4% of the U.S. population identifies as Black or African American. Of those, over 16% reported having a mental illness in the past year. And so to kind of better understand that's over 7 million people, right? Mm-hmm. And again, I think it goes back to the point that we were saying earlier is you have to understand what people are going through in order to better, treat our patients. And I think having these conversations is important for those reasons.
I think you brought up a really good point about platform, right? All four of us have an Instagram platform. We have, thousands of followers between all four of us combined. We probably have over 10,000 followers. And I think one of the most important things is, showing others that follow us that we're not perfect. I think a lot of people get in this trap of posting, glamorous pictures, posting when they're the happiest, posting the, sunshines and rainbows. And it actually makes it a lot worse for people who are going through, hurdles in their life, because they're looking at everything on their social media feed, and all they're seeing is, how people are succeeding, how people are, getting into PA school, how they're doing well in life. And literally they're sitting here and they're like, well, I'm not doing well, so what's wrong with me? And that's kind of the mentality that is sets in. I remember being a pre-PA student, I didn't use Instagram for the PA forums. I didn't go on these PA forums and stuff like that because it was just a lot of people that were succeeding. And for me, it was too painful to watch that many people succeed and not feel like I was a failure and not feel like I was the only one that wasn't able to keep up. And it put me in a very negative place. And that persisted all throughout a majority of my first year, I'd even say, you know. And so I think it's important it's good to put all the positive stuff, you know. I don't want to tell people not to put positive stuff on Instagram because I think it's good. It's a good outlet. But at the same time, you know, it's okay to show vulnerability to others, you know, and some people just don't feel comfortable with that, and that's fine. But I think that sometimes as, you know, people that have platforms, we need to show others that we too don't succeed at times. And it's perfectly fine not to succeed at times because in the end, we will succeed.
Mm-hmm.
Okay. Well, I hope we continue using our platform to speak about these important issues. I find that, or one realization that I've had this year is, I think self-care is often seen as a treat, as a prize. Like, you know, after I do all of the studying, I'll do this activity, this hour break as my self-care. And I think we need to have a shift in that mentality so that self-care is not something that we have to earn. Self-care should be the lifestyle that we live. And at the moment that we feel we are sacrificing our mental health, our self-care, our mental well-being, then we need to be able to recognize that so that we can recuperate and, you know, continue to help. Because as you guys were saying earlier, you can't fill from an empty cup, right? So you have to look after yourself. Self-care has to be a lifestyle and not something you earn after, you know, sacrificing your mental well-being.
Last thing I'll say about that, man, and it's spot on. And you know, everybody's self-care comes in different forms, right? And I feel like I've learned the hard way that this whole thing, PA school, getting into PA school, life in general is all a marathon and it's not a sprint. And you know, so often I'm just like boom, 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 always on the go and like sprinting, and then all of a sudden I hit that wall and I'm just like, I haven't taken the time to, you know, absorb and evaluate the things that have happened to myself, things that have happened to other people. Instead, it's just all been like reactionary, right? And it's just like, you know, I'll deal with it later. I'll deal with it later. And then when I hit that wall and when I blow up, and it's just like, yo, you need to chill and really reel it in and understand life and what has been going through, what you've been going through, what has been happening. And then understanding that will lead you to, like you said, more self-care that's not tied to incentives, right? So it's not like, oh man, I gotta like grind it out and then like I'll get to enjoy X, Y, and Z. It's like, no, you know, like small breaks here and there and enjoy when you feel like you need to. There's no rule about like getting it after you're, you know, suffering and pushing yourself through all of your obligations and all that.
I agree. I definitely agree. It's just like when people ask, oh, you know, you're about to be finished school, like, you know, you should be excited, you know, stuff like that. And, you know, most of us do feel like that, you know, it's been a marathon, right? We're like, oh, and when you have a marathon, you look forward to that finish line. But the thing is, there's not gonna be a finish line until, you know, essentially, you know, we all pass and, you know, pass, I mean, as far as expire. So everything up until then, we need to take time and enjoy. So even right now, when we're going through some of the most difficult times of our life, I would say it could be worse than this, right? I mean, we should actually be enjoying this. Like, there's been so many, you know, pros that came out of, you know, every stage in our life, essentially, that we need to spend some more time in acknowledging, right? To, even if it just helps uplift us for a second, for a minute, right? It's better than nothing. Because like I said, even when school's over and now we start working, it's just another hustle, another level that we're going to meet with its own obstacles and barriers. And then we're going to be looking back like, oh, damn, I wish, you know, we was back in school. Like, you know, when we get into the real life, you know, I mean, this is real life, but, you know, it's even crazier. So, I mean, even what we're doing now, like we're taking some time out, we're discussing some pertinent issues, right? This is some therapy in itself, right? We're having some time reflecting on how far we've came. So I think we need to continue to do that, and especially for everyone out there, like the pre-PA or whatever students, or even if you're not a student, just take time and enjoy life. Like, we don't live to work. You understand? So you gotta enjoy this stuff. You gotta enjoy your life. You only have one, so really just try to live it up.
All right. Well, if you guys, does anyone else have anything else to say before we move on to Minority Report quarrels?
I do have one thing. Since we talked about trauma and we brought up somatization, I think a lot of people that listen have never heard of something called tension myositis syndrome. It's basically, when people have undergone a traumatic experience, they tend to be a type A personality, or what one of the doctors I work for, Dr. Schechter, termed it type T personality. It's, perfectionistic, driven, very hard on yourself, very motivated. People that have suffered trauma, whether it's, a traumatic, sexual abuse, whether it's the loss of a family member, whether it's, some kind of form of trauma. And the thing about trauma is it doesn't have to be self-experienced by yourself, right? It can be experienced. You can see it, you can witness it, you can hear about it from someone else, right? That's one of the criteria for PTSD. And, I feel like we brushed through the topic of somatization, where people experience symptoms that are, you can't really find a cause for it. And, having worked for this doctor for 6 years before PA school, and something that I was really interested in, I think it's something that people need to recognize, that, people that are experiencing pain or random symptoms like numbness, tingling, burning, and we can't find a cause. I mean, sometimes that cause is a mental health illness, and it often gets overlooked because we do not get that education that we need, and I feel like it's a topic that gets suppressed a lot by, bigger bodies, because no one really understands the pathophysiology behind it. No one really knows why it happens, right? Which is a lot of it's pretty much mental health in a nutshell, right? Sometimes we don't really understand why, and therefore it gets ignored a lot. So, whether it's tension myositis syndrome or TMS, or, some other mental health illness, I challenge people after watching this podcast to look something up that they've never heard of before, or never thought about, or don't know about, and try, you don't need to become a PhD expert in the subject, but educate yourself just a little bit, because you never know. You might come across a patient and you might be able to diagnose them with that, and that might, change their life, So I think we owe that to our patients at the very least.
I want to recap a few points, and Sato, that was good. You actually told me something new right there. So I want to recap on a few points, right? So to address these issues, we got to understand, why they exist in the first place, right? Knowing that it's not just one factor, that it's a result of many, right? We talk about policy decision making. Those are things that are going to help move us forward, move the mental health illness along. I see that there actually are starting to get more money in the field, which is a great thing. Health education, we have to educate ourselves, educate our patients, understand that a lot of risk factors are environment, genetics, understanding some of the issues as us providers, money, right? So understand that some of these patients may have to choose between medicine versus their food. Understand that some of their insurances might not even pay for these additional resources. So being equipped and making sure that we can find some alternatives for them as well. Also logistics, right? So some patients, we might not even have enough providers in their areas. So trying to go that extra mile and try to find some resources that are more accessible for our patients, right? Trying to get some more access to better foods and understanding teaching them how to deal with stress as well, like in our visits. And again, for us providers, we have to understand cultural competency. It's going to be many patients that's going to come in with language barriers, right? That's a barrier that may inhibit them from getting the right care. So And also, that can lead to misdiagnoses. I read something about that as well, which can ultimately lead to distress. Another thing we didn't mention was ACE. You guys learn ACE in school? Adverse Child what is it? Average Child Experience. So basically, it's saying like children like under 18 that the stresses that they go through eventually manifest into a lot of physical and medical comorbidities. So like understanding that in your population, knowing how to screen for that. And I'll leave one more thing till we get to the MRPs. Suicide Prevention Hotline. I wrote that number down. 1-800-273-8255. 1-800-273-8255. Don't be afraid to reach out or talk to someone.
Thanks for doing that,
Thanks,
bro.
Carl.
Mm-hmm.
Yeah, I think that's definitely a number that we should all have saved in our phones, so that for ourselves and for our patients, just for easy access sake. And again, to echo what Carl said about it being multifactorial. Yeah, mental illness is considered as a byproduct of complex issues like that include basically biological, psychological, social, and cultural factors. And one way of addressing it is therapy. I think we need to normalize therapy and also combat the stigma that is around that, which brings us to the Minority Report Pearl.
It's time for this episode's Minority Report Pearls. These are valuable tips from the Minority Report that are relevant to this episode's topic of discussion.
Which is a quote that I found that I think addresses this. And it says, anything that's human is mentionable, and anything that is mentionable can be more manageable. When we talk about our feelings, they become less overwhelming, less upsetting, and less scary. By Fred Rogers. And
shout out Fred Rogers.
Definitely. So I haven't used therapy services yet, but I definitely see the value in them, and I am committed to recommend that to my future patients and make that part of our normal conversations. Well, we hope you enjoyed today's podcast, and if you have any questions, feel free to reach out to us at our social media platforms, as well as if you have any suggestions about future conversations we should have. Carl, where can they find you?
I'm at White Coat Black.
Aaron?
And you guys can find me on Instagram or Twitter at Aaron Anchor.
And Sato?
My Instagram is hardworkpaysoff29.
And what about the Minority Report podcast?
And our podcast Instagram is minority.rapport.movement on Instagram.
I can spell report, Sato.
It's RAPPORT, rapport.
All right.
Awesome. And you guys can find me at thefit.pa.s. Thank you for listening, and we hope you tune in next time.